Hi, this is Trevor from Wozen Photonic Therapy. We are now going to give you a little presentation on how we actually assess our horse and how we address any little problems I'm going to see. We'll run through the basic points, and we always use the McLaren method. Dr. Brian McLaren was the inventor of this therapy, and he's a clinical scientist and was also my veterinarian many years ago. Although he's now retired, I still have quite a bit to do with him when we go through some problems we may have. Now, the first thing that you must always do, you must be working with your horse in short sleeves or the sleeves rolled up like I've got here, and that gives you puts you in the horse's magnetic field, and the horse generally will not even bite you or look like biting you. It might nibble your shirt, providing you are in this magnetic field. When you're using the probe to test these points, we hold the probe in the hand like so, which is an extension of our forefinger, and just run it along the areas. We don't do along here only other a couple of points, but we just do run it along here with a reasonable amount of pressure. Now, the first point is what we call point 1, which is up on the top of the atlas. It's 2/3 the way up from the wing of the atlas. You'll find there's a little point just here. Make sure you got your arm on your horse, run your probe down on the side of the horse. Now, if that horse had a bad hindquarter on the offside, he would swing his head around. That's point 1. Point 2, we zigzag down his neck, and if he's got a problem, it says he's got a problem there, it's either the neck, shoulders, or the croup. But we also then extend it down a bit along his neck, around the vertebrae, and you will find if the horse is either chewing the bit or he's just flickering at the corners of the mouth, he's trying to release endorphins to get rid of the pain wherever it might be. So there's 1 point there, 2 point there. The third point is down the collar groove, where years ago we used to put a collar on a horse on their draft horses. Again, you have the probe in your hand, you change the hands around now and run it down his neck, and you scrub shoulders, knees, lower front leg. So that's shoulders, knees, lower front leg. Now, if that horse had any problems with his shoulders, his knees, or his lower front legs, he will tell me on here. That's point number 3. That's point 3, which I call 1, 2, and 3, 3. From there, we run down the muscle that runs down his neck, finger underneath here. And if that point there is point number 4, if he says if he's bringing his head back in towards you, you nearly guarantee he's got teeth problems. And sometimes, but if he doesn't have a tooth problem, it can be a stifle problem. That's point 4. Point 5, we just flick under here. That is just checking his he's either got corns or he's got an abscess coming in his foot. Point 6, on the shoulder, just do a cross where we used to brand them from this point of the shoulder through, and if he has a problem in his shoulders, he will certainly tell you there. That's point number 6. Point number 7, if you run over the scapula into a hole, fall into a hole here, which is bladder 13, make an equilateral triangle, and that's what we call bladder 23. You can either do it that way, or it's you've got the top of the hip here and the top of the spine halfway down. So it's very easy to pick the point up, run a line back to here to work on, find a hole about in the middle, which is bladder 18, and that's where we start from the front end. So you go 1, 2, 3, 4, 5, and this is all what we call the associated points, so we can virtually tell what the horse has any problem there. Turn you around again, you put your arm on your horse, and that's 8, 19, 20, 21. So it's the last rib coming up here, and that's where we treat a horse if he's got colic. So with this, that's 21, 22, 23, 5 over to the top of the poverty groove. 1, 2, 3, 4, 5. Run back up to the top of the spine and down the side of the spine. If he does a reaction there, you know he's got sciatica. So that's that's 7. That's point 8. Run down, do a sharp as if you're striking a match down the poverty groove, and that will tell you if he's got hips, hocks, or stifle problems. Then you come down to the hip, you punch in spine, and then this horse I can feel he's got a little bit of soreness in there. I can feel it with this hand, but it's just not too bad. Check to see if he's got on point 11, if he's got a problem with his stifle, and that will tell you, which he has. Hips and hocks, just over the top of the hip, there's a little hole here, and if he's got a reaction there but nothing down there, you've probably got a problem with his hocks. Point number 12 is down the side of the ribs. If it's a mare, she's got a reaction there, you know that you've got a cystic ovary on that side. 13, out, you just make your tram tracks here, come out and stop, and you'll know whether you've got a muscle problem. This lumbar muscle here will come up and down if it's okay. If there is a problem, it will come up and stay up. And then if you go underneath your horse here, right in the centre of the stomach, if he's got acidity or ulcers, he will certainly tell you straight away. Now all of these points, there's 9 points then to treat that we've got on the horse, and we use an advanced torch, which again is developed and made in Australia by advanced photonic therapy. And all we're going to do is treat these points just for 4 or 5 seconds on each point. You've got no worries of taking any particular time. If you do have a problem in the shoulder, you can paint the shoulder with the torch. If you have a problem in the withers here, just run the torch either side of the withers, and you will find that that'll take all the soreness out of there, because what we're actually doing, we're changing the electrical potential of the skin. So instead of it being acidic up here, we're making it alkaline, so it takes all the soreness out. And with a horse has a sore in his neck, and he's starting to chew the bit, if you just run this slowly up and down there, as you can see, this horse is starting to put him slightly to sleep and releasing serotonin. You will save that problem. This particular horse, he's a little bit sore in the neck there because he has a little problem with his back. Also, if I get the big torch and I'll show you, this is a new torch that we developed in Australia, which has 3 different settings on it, on the face of this the torch that we have now, specifically to treat all the hind quarter, because with the other torches it takes a fair bit of time, and this torch now is being used by some veterinarians in Queensland for horses who've had big operations to improve the oxygen and the blood flow, throughout the body. So you can see, I can feel this horse now. He's really relaxing. He's letting off some wind, but with the smaller torches, just although they still do the same job, it just takes that much longer. So we've developed this torch now to handle all these major problems that we have in the sacroiliac and so anywhere in the back we have a lot of problems running through the sacroiliac and also sciatica, which is running down through the side of the spine. So hopefully that gives you some idea of the McLaren, the Wosen Photonic therapy using the McLaren method, which is certainly the Rolls Royce of photonic therapy.